not only how do I find patients, but how do I find the right patient? And part of understanding the right patient is actually tracking that you are driving patient appointments in the first place. A lot of advertisers, where we initially get involved in relationships with them, they are tracking all kinds of things. Very infrequently are they tracking new patients and new patient appointments. Typically, what they track are things like click to calls or calls that are over 10 seconds long, form submissions. Some more and more advertisers we're seeing now are actually tracking online appointments, which is a huge step up. But we have a lot of tracking problems with clients when we first engage them. What you want to be tracking is online appointments and phone call appointments. And if possible, there are even ways now to track appointments that were generated from an initial form submission. These are the things that are going to help you optimize towards driving the right patient. So not only patients, but the right patient, right? And with these lead basis tracking solutions, like this is a screenshot from Line, not only can we track patients, but we can track different types of patients, right? Who are after different service lines, and we can even assign values to those patients depending on what service line they're looking for, what appointment type they're coming in from, and then send that data back to Google Ads or send that data back to Meta in a HIPAA compliant way to say, go find more people like this because this is the right patient that I'm looking for. And so the last slide that I'll touch on, and I just alluded to it in the previous slide, is it's not about just tracking patients, but it's about sending that data back in a HIPAA compliant way to then optimize to get more of those kind of patients. And there are various ways to do this. There are offline conversions, which are conversions that are sent essentially into the back door of Google using a Google Click ID as an example, or in Facebook using a Facebook Click ID, that you can do utilizing most call tracking solutions. So if you use something like Line or Invoker or Patient Prism or CallRail, you can send offline conversions back to advertising platforms. You could directly integrate your CRM if you have one. So if you have a CRM like Salesforce, we have clients who directly send leads when they hit a certain stage in the patient journey back into the advertising platform to optimize against and try and chase more of those. That's particularly useful if you have a CRM and you have a more complicated patient journey and you're looking for a higher consideration patient. And then there are third-party solutions, HIPAA compliant alternatives to Zapier. Here we mentioned one called Cardinal that allow you to send data from one platform to another in a HIPAA compliant way. This is also a method for sending conversions back into advertising platforms that allow you to optimize against downstream patient activity as opposed to higher up lead activity. So that, what I just kind of covered off very briefly, is the foundational work to setting yourself up for success in terms of finding the right patient. And I think now what Evan is going to take you through is actually then optimizing those campaigns once you've done the foundational work. So I'm going to hand it over to him.
That's right. Thanks, Rich. Yeah, super excited to talk about how we kind of take this information, put it into action. As Rich mentioned earlier in this session, and we're also having a session tomorrow, goal planning is going to be one of the biggest things, the first things that we focus on. I actually like to think of building out campaigns and the strategy like kind of building a house, right? Goals and objectives are the first things. Then we want to make sure that we're building the foundation and framework before we get too in the weeds with granular details. So in the next few slides, this is kind of going in descending order. We're going to start with channel strategy. What do we do first? What channel should we be running on? And then get more into the details. So one of the first things we look at when Cardinal gets a new client is the channel mix, right? It's so important to make sure that we're aligned with the goals that we have in the near term versus long-term objectives. I think everyone would say that the long-term goal for most businesses is to continue to expand, and that typically means going into more and more channels, right, to reach more patients. However, I think we want to make sure that we are cognizant of the moment. What is most important now? Let's make sure we're aligned there. So starting with that, the first thing to know is understanding the strengths and weaknesses of each channel, right? I think we're all familiar with search. That is typically the highest intent platform. So people that are most ready to convert Facebook is kind of social, falls a bit in the middle, right? There's good engagement, but it's also a lot of awareness-based work. And then of course, programmatic is kind of the broadest. So when we look at where we start, what we need to be focusing on now, we always start there. We often have clients come in fact, that their priority is they desperately need leads and patients. But they just kind of have grandfathered into the running social and display. And one of the first things we often do is, well, maybe let's dial back. Let's focus on the near-term goal. Let's run some awareness, but make sure we're delivering you those patients first and foremost, and then we can expand and kind of broaden our strategy. When we look at that need, patient volume, brand awareness, or both are things that we consider. There's sometimes, like I said, that leads now are the most important thing. There's other times when, lead flow is pretty good. They need to expand and they've hit some of their limits in search. So we're going to have to do some awareness and full funnel strategies to reach more people. And then finally, we have instances where both are needed. We have a primary care group that has multi-local. They need support for leads for existing locations, but they have de novos that are launching throughout the year. So those, of course, need some awareness and pre-launch support. So you just want to make sure that we've got the right strategy at the right time. The last thing I'll say here is let's not forget about SEO. When we talk about channels, we typically, when we talk about goals as well, we want to make sure we're thinking of the full picture, and SEO tends to be part of that. So prioritizing content or updates to the website, that can be leveraged in paid media. Let's make sure that we're thinking about these channels as well, just rather than just paid. Next on the list, when we kind of get into the platforms, we've decided which channels we're going to run, is making sure that we're, when we talk about ideal patients, that we're actually correctly prioritizing and targeting them. It's often the case that we'll meet with clients and need to work on things where people want leads, right? But we know certain types of patients are much more valuable, but all leads are currently being treated the same. So obviously we want to start with outlining budget and performance goals first by patient priority, right? Let's take an instance of, we've worked with aesthetics and plastic surgery groups that offer something like injectables, like Botox or kind of med spa services, but also plastic surgery, which has a higher margin, right? So we don't want to treat all leads. Let's just get all leads. No, let's make sure we understand the value of these types of patients, and then we apply the right budget and goals to them so we know where we're at. The second thing I'll say is deploy campaign structures that give us the levers we need to control that volume, right? We don't want all these things bucketed into one campaign group. Let's make sure if injectables is less valuable, it's in a campaign, we can set its own budget, we can drive the right volume there. And then separately for surgery, for example, we can also attribute the right goals, efficiencies, and budget there as well. Of course, each of these will have different targeting requirements, right? Someone looking for injectables or a quick stop-in is going to be different than someone that's doing something like a mommy makeover or a plastic surgery procedure, right? It's more considered. It's a different demographic, conceivably, not even to say different geographies, right? Lastly, one of the last couple things here is, of course, overlay global targeting support that maybe is uniform amongst everything, geography, demographics, certain things that hold true to all of the patients that you're going after. And the last thing is, let's always keep testing. Let's not set an assumption and stick with it. We want to design these things a certain way and then make sure that we're trialing new audiences and we're assessing these as we go forward. All right, great. So the next thing that we often think about is conversion optimization KPIs. I know Rich touched on this a bit about how we do this, how we organize this in the CRM level and pass back the right information. Obviously, we want to translate that into in-platform needs. What are the KPIs and desired impact for each channel? When I talked before about the mix of channel mix, whether you're going to do search and social, a lot of those are going to be different. Social, we often see is frequently less efficient or lower conversion rates than others, than search, for example. So let's make sure that we dial in the KPIs and the expectations there. Knowing the conversion path from lead to patient is very important. So we know when we get a lead, it trickles down into a patient start at this rate. we definitely, another thing we want to do is segment conversions to represent priority service lines. If we're able to say this is a conversion action that is, say, an injectable, or this one is a plastic surgery lead, then we can tell the system which is more valuable and assign values to these conversions and ask them to get more of these higher value patients. And finally, utilizing value-based bidding. When you apply these values to your conversion actions, you can tell the system that this one's more valuable. They will optimize towards driving this lead type for this patient type more frequently, and ultimately give you a higher ROI. And then the last thing, of course, as we drill down into the more granular depths, is let's make sure we're speaking to your ideal patient. It's often the case that we've seen where, you know, all ads are kind of roughly the same. It's a more generic service offering ad. We want to make sure that we've identified these ideal patient groups and we're speaking to their needs directly. So using relevant value propositions, motivation, and calls to action. What do they care about? What's going to get them motivated? Let's say that to them. Let's make sure the landing page is highly relevant so that we're not sending them to a generic page. If they're looking for injectables, their experience from ad to landing page should be one smooth transition. Definitely want to, when using multiple funnel stages, if you're running top of the funnel, video, mid funnel, and lower funnel, you also want to overlay the right type of messaging at the right time. At the top of the funnel, it's more informational. At the bottom of the funnel, it's action oriented. So don't use all the same messaging across these stages. Make sure to curate that for the right time and the right place. And then finally, of course, set a reliable cadence of testing and analysis. We often like to do it quarterly. You update ads, you run them, you do assessments, you filter in new options and test from there.
Hey guys, popping back in to facilitate a little bit of Q&A here as we wrap this up. I saw two really great questions, and the chat has been blowing up with people answering, helping each other out here. Mark asked, how do you know what value to tie back to a conversion action? And I know we do this all the time. There's different ways to think about it. There's the relativity model. There's like the actual model. Rich or Evan, any thoughts?
Yeah, sure. I mean, what value to tie back? Often, I mean,
like to different conversion actions,
sure.
Right? So whether it's different service lines or types of conversion, like how do you know what value to set?
Yeah, it's often the rate at which they matriculate through, right? If there is a lead and then there's a qualified lead and then someone sets up a consult and then they become a patient, right? The rate at which, say, a phone call translates down that is typically directly the value we would assign to it.
Yeah, the conversion rate for the action to becoming the patient, and then if it's a specific type of patient, will also be the other factor to look at, right? So if someone is coming in, and I think I leveraged this example before, because they're looking for med management and therapy, you might know that the lifetime value of that patient is $1,000, but someone who's coming in just looking for therapy alone, maybe the lifetime value of that patient is only 500. So it's the combination of the rate from lead to patient and the value, the estimated value of that patient based on the selections that they make as a lead that will inform the value. And I think the key piece is these do not have to be exact values that you use. They just have to be relative to one another. So if
Exactly.
a calls from ad is $1 and a calls from a website is worth 5 times as much to you, that can be $5. It doesn't have to be $1,000 and $200, right?
This doesn't have to be where we actually extract
Right.
the ROI number at the end of the day. This is in order to inform and create a really smart machine that's scalable. So I think that's a great call out. Guys, I know we didn't get to all of the questions. As Alex mentioned on the morning session, there's going to be a full Q&A session tomorrow. The lobby, which we forgot to mention, has opportunities to engage, to look at the upcoming sessions. There's active expos going on in the lobby right now. You've heard us talk about a lot of these great call tracking vendors, some strategy partners that we have. Check them out in the expo and learn more about those. Rich, Evan, and myself are always available on LinkedIn. Hit us up through our website. We can have one-on-ones to answer more questions. But thank you all so much for coming. I'm going to close this out here, and that'll kick you back into the lobby where you can get oriented and figure out where you want to go next. Thanks, Rich. Thanks, Evan.
Thanks, guys.